It's always better to have control over the disease than the disease controlling you.
How do you define cardiac fitness?
Actually, I think cardiac health and orthopedic health, they go hand in hand.
When it comes to the frequency of exercise, what do you recommend to keep a healthy heart?
I think we should exercise 6 days a week. One day give your body complete rest. Beyond the point, I think a little bit of the social media has also caused a little too much of bombardment of these things. Probably this was happening earlier also, which we didn't know of, but now people are more aware of it. So Srinivas, one thing I wanted to know, you being an athlete, me being an athlete, how do you try to be injury free? One more issue I think is the COVID that happened. It's caused a lot of inflammation.
Hello all, I am Dr. Srinivas Thati, Director and Head of the Department of Orthopedics, Trauma and Sports Medicine at AIG Hospitals. I welcome you all to AIG Ortho podcast series. Today we have one of our best cardiologists not only in Hyderabad but in India, Dr. Anuj Kapadia. We'll discuss about how cardiac health and orthopedic health interplay between each other. Welcome to the series, Anuj.
Hi,
Thanks
Srinivas,
for
how are
your
you?
time.
Thank you so much.
Yes, when we think about any sporting activities, we always think about how we can protect our heart, how the heart need to be fit. How do you define cardiac fitness?
Actually, I think cardiac health and orthopedic health, they go hand in hand, because I think joints and muscles are extremely important, as well as the heart muscle is important, and they are important to each other. Now, coming to heart health for exercise, I think it's very important that we see our heart rate variability, our resting heart rates, and how our heart rates go up with exercise. These are very important to play, and I think as we exercise, our heart health improves. That's when our heart rate variability improves, our resting heart rates go down. That's when you actually know that your heart health is better. When some people with minimal exercise, their heart rates go up very much. They are exercise detrained. So as they keep increasing their activity, that's when their heart rate variability gets better, and their heart rates actually shoot up lesser. They train in zone 2, zone 3. That's when actually you're more healthier.
That's a good start. So, we never thought about heart rate variability in the past.
Yeah.
This is a buzzword which we are using nowadays more often,
Yeah.
and we got the zone 2, 3 phenomena. Can you explain more about how do you see the variability? What is the patterns which can affect the heart health more often in younger patients and also in the elderly?
Yeah, so basically heart rate variability is based on our vascular tone, and there is something called as vagal tone, there is something called as sympathetic tone. The more your sympathetic tone is more, that's when your heart rate shoots up very quickly. And the more you exercise, your vagal tone improves.
Yeah.
That's when your heart rates are more stable. The jump of your heart rates is lesser. That's when you train in zone 2 and zone 3. Zone 2 and zone 3 is where your heart rates are below 135, 140 at your peak exercise. So when you peak your exercise, suppose you're running at 6.5 speed per and your heart rates are around 130, 140, you're great. But if suppose your heart rates increase to 160, that's when you actually need to train more and probably increase your aerobic capacity more. You need to run slower first so that your vagal tone improves. That's when you will be able to, your exercise performance also increases.
Certainly, that is a very important thing to understand, how you can maintain the heart rate around zone 2 within zone 3. Going beyond that, what complications can you expect?
The most important thing is we will have to end up with you. Because the more you push yourself when you're not properly trained, that's when I think we end up with a lot of injuries. One, from the cardiac perspective, I think you get fatigued earlier because you get tired faster because your heart rates are so high, you're not able to compensate. That's when you may develop rhythm issues, you may develop cardiac issues, your blood pressures go up very high, you tend to not be able to exercise as well as you can. So I think that's very important.
Certainly, I think one of the important aspect is a lot of us just rush into the activity.
Yeah,
Before going into the activity, it is always better to warm up a bit so
absolutely.
that the oxygenation, the blood circulation goes into the muscles very regularly, so that there won't be local acidosis.
Correct.
In muscles particularly, I think if your heart rate has not improved and your rate is at a bit lower level and you're not breathing well, that mismatch can create the injury at the muscle level.
Correct.
So that's where the muscles can get injured quickly.
Actually, the
So-
lactic acid actually accumulates.
Correct.
So that's what they say. You warm up, you exercise, you cool down, you stretch.
Yeah.
Those are so important because
Very important.
you don't take care of even one of those components, you end up with some kind of injury. Either you have a spasm of your muscles, or your joint goes for a toss, or you get fatigued earlier, or you're not able to complete the exercise that you want to do.
Absolutely. When it comes to the frequency of exercising, what do you recommend to keep a healthy heart?
I think we should exercise 6 days a week. One day give your body complete rest, which is very important for the muscle growth as well as for recovery. Recovery is as important as the exercise that we do, because you tend to get injured more quickly if you don't give your body that amount of rest. One. Second, I think half an hour a day minimum of exercise, be it cardio, be it strength training, be it mobility exercise, is very, very important. I think it is a balance between your cardio, strengthening and mobility, which is very important. But at least 30 minutes, 6 days a week.
What kind of activities do you recommend?
Cardio, I think first thing is, I think whenever somebody is starting exercising, it has to be a gradual build up. We don't want to start off with something. There are so many patients who say, I went and did 2 hours of exercise, but they don't do it consistently, and then they get injured or get tired and they don't go ahead. So I think consistency is the name of the game. One. Second, I think it's a gradual build up. Body is a very stretchable system. You can push it beyond what we think we can, but it has to be a gradual build up where you will gain strength over a period of time. Shouldn't get impatient with trying to outperform yourself. Gradually build it up to as much as you can.
What symptoms, if I started off and I don't know how the heart health is, there are two ways of going about it, right? We can get screened,
Yeah.
or we can go a bit slowly and looking for the symptoms.
Yeah.
What do you suggest screening wise?
Screening wise, I think it's very important that we do a baseline health checkup where you do your basic blood workup, you do your lipids, you do your cholesterol, sugars, as well as a basic ECG, a basic echo, and a stress test. Stress test could be a treadmill, could be any other form of stress test as well. But somebody who can exercise, I think treadmill is a baseline exercise that we need, because that will show us whether there are any underlying blocks. It will also show your exercise capacity. So it will be a functional testing, as well as you will know whether you have some problem, so that you don't end up with any trouble when you start exercising.
Normally we see there are two types of exercise guys who are very regular, some of them are weekend warriors. So how do you counsel them so that they can come to a regular activity?
No, it's very heartening to see that I think there is a little awareness that's now slowly building up. You see a little more number of people actually exercising, though still I think only 1% of people of the whole population is coming to exercise, or probably even lesser. I think people have to be patient with exercise. It is a daily habit. It's not that we become unhealthy overnight.
Correct.
So it takes time to become healthy also. It's a process that you have to follow. I think it's more about the consistency of doing it and being patient and doing it on a long term. I think like we do our brushing in the morning, I think we need to do our exercise before we start our day.
Yeah.
It has to be a part of our regular routine process that we do on a daily basis, and you should start missing it if you don't do it. That's very important, and I think that in a span of time will show its effects. People will become leaner, people will become healthier, they are more endurance wise, they get better. And automatically, I think once they start exercising, they have that thought that okay, I should eat better because I'm working hard for something. I think I need to modify this as well.
No, that's a good way of going about it, right? It's not just one thing.
Correct.
You got to look at as a wholesome.
Yeah.
Not only the activities, you got to look at your diet, you got to look at your stress,
Sleep.
all these are important.
Yeah.
When you do everything in a correct way, then certainly everything will be normal.
Correct.
And you can live a longer life.
No, I think it's very important that we realize that we don't become unhealthy in one day. So automatically it takes time for us to get healthier also.
healthier
It's a way of life and that will change over a period of time. So continuously exercising will help us become healthy over a period of time.
Absolutely. So one other thing, once we get screened and if everything is normal, I start doing the activities, and what do I need to look for to know if there's anything wrong with my heart?
See, if you're doing well and suddenly at some point you feel that this amount of exercise which I was doing, I'm getting short of breath.
Right.
I'm developing some kind of palpitations, or there is some kind of chest tightness because of which I'm needing to stop. I'm getting giddy when I'm doing my maximum exercise. I think you need to slow down, get yourself reevaluated, go back to your physician, let him check you up, and then take it forward from there. Because probably these are symptoms, early symptoms that you need to hold on to. Please, I think we should not ever stretch it and say, let's see what will happen. Maybe it is just acidity, because we as human beings tend to just attribute it to something which is more convenient. We want to just attribute it to gas, we want to attribute it to acidity and just say, it's okay, maybe it's just acidity. We land up with a catastrophe. We don't want that.
I think better to take
There's
early
nothing
precautions,
wrong. Yeah,
and
there's no
prevention
harm.
is always better than cure.
It's actually, it's always better to have control over the disease than the disease controlling you.
Absolutely, that's a good way of saying it, right?
Yeah.
So there are a lot of training centers have come up, and we're talking about different kinds of activities like HIIT.
Yeah.
And what is your opinion? What would be the best kind of activity to keep a healthy heart?
I think it's a combination of cardio, HIIT and mobility.
Right.
Because as we grow old, I think most important is we need to have enough muscle to have your joints strengthen. Because the more the muscles become weaker, I think the joints become unstable and cause a lot of pain. I think it's for you to tell more about that. Second, I think it's important that we have flexibility in our life as we grow old.
Yes.
And third, I think your heart health will get better the more you do cardio. Your endurance will speak for your heart health.
Correct.
So a combination of all this, I think, will be a great thing for a fit person.
So if somebody already has some cardiac issue,
Yeah.
can they do HIIT or run for a longer period?
No, I think it has to be built up over a period of time. Please take the opinion of the treating physician, because they know your heart health better. See, somebody who's undergone a bypass or has undergone an angioplasty, whose heart muscle and his ejection fraction is good, his heart pumping is good, they can live a normal activity, they can go for their jogs, they can build it up over a period of time. Start off with walks, gradually start increasing your jogging and your speed, start with lesser amount of weights and then go on to increase your weight training. You can do body weight training as well over a period of time, but that has to be very gradual. It cannot be that overnight you start off and increase the weight, because that will actually worsen the heart issues.
And not only improved activities, we are also seeing kind of increased use of supplements. Okay. As a orthopedic sports surgeon, I'll be very careful in suggesting any supplements. Are there any specific supplements do you suggest for keeping a heart healthy?
Most important, I think, is multivitamins, which are age old and which are very important because they are important for our metabolism, for our muscle growth as well as overall growth of the body. Second, I probably give magnesium and fish oils, omega-3 fatty acids. Other than that, I think the world has been bombarded with a lot more, which is not important. High protein intake, probably yes, but I think natural high proteins, egg whites, chicken, fish, probably paneer, a lot of your legumes and rajma, chana, all that helps. Our Indian food has enough protein actually if you want to. Over and above, somebody is into a lot of muscle training, probably then probably one scoop of protein is fine, but beyond that, people are now, I think, overdoing it, which is not good for the kidney health as well.
True. So we have been seeing a lot of use of supplements, and a lot of younger generation have been using quite a bit. Not only that, recently we have few celebrities who dropped dead while exercising, and that is really very difficult to accept. As a cardiologist perspective, what do you think is the reason for sudden death?
See, there are 3, 4 things which I think of. It's probably not only the supplements, but I think it's overdoing the exercise is one thing, which I think is a major issue. Second, sleep. I'm not sure how many people sleep properly. Smoking, alcohol. These are things that are an undercurrent that goes on with the younger generation. So, and I think genetics also plays a role. A lot of people have heart health issues at home, which they don't screen themselves into. So, I think proper screening is important. Smoking is one big no-no. Junk is a big no-no. There's so much of junk that's happening in the younger population, which I think our generation probably didn't have at all, so we didn't go through that. But now I think it's a way of life, which I think people have to be aware of. I think Swiggy, Zomato, it's become very easy to click at a click of a button for things to come home, right? So it's become a lot more than before. The palm oil that we use in the food outside, these are all not nice. The trans fats basically.
I think it's not just the exercise, right?
It's a lot of other things.
Yeah, which also can affect how your
correct
systems work, particularly heart health.
Beyond a point, I think a little bit of the social media has also caused a little too much of bombardment of these things. So probably this was happening earlier also, which we didn't know of, but now people are more aware of it as well.
Yeah.
One more issue I think is the COVID that happened. It's caused a lot of inflammation. And the viruses beyond that have come. If you look at it, a lot of people who had common cold earlier used to recover in 3 days and now taking 15 days. There is a general inflammation in the system as well. So which also contributes when you're exercising during the inflammation. It can cause plaque ruptures and cause these issues.
Yeah, I think that is something to be observed, right? And you see, one other thing is how can we monitor our heart rate? There are so many variables which have come up now.
Yeah.
And with the AI technology coming into our life, what do you suggest the best way to monitor your heart rate, HRV?
So I see the 2 very user-friendly things in terms of gadgets is one, your watch, because it's on your wrist all the time. It can actually manage your pulse well. Second, probably the rings that have come in, which also monitors your sleep very well. So because sleep apnea is a major issue in terms of sudden deaths or premature cardiac disease also. So that also helps in monitoring these things. They are actually very helpful. I wear a Garmin as well when I run. So it actually helps me find out, and also helps me in monitoring my runs, know where I stand, how I should improve. So these are good things to have. Rhythm issues can be caught up much earlier. So some people have rhythm issues during exercise or otherwise as well. So that also comes up. We are seeing a lot of patients who come in with ECGs from their watches. They have irregular heart rate, so we treat them earlier than what they could have otherwise come in.
That's a really good thing.
Yes,
right?
absolutely.
That's
it's life-saving sometimes.
If people can start using them while doing the exercises, it can help in early detection of the problems.
Life-saving. It's life-saving lots of times.
Absolutely.
So Srinivas, one thing I wanted to know, you being an athlete, me being an athlete, how do you try to be injury-free? Because I think the zeal of exercise that we have gets truncated once you have an injury. So how do you protect your joints? How do you protect your muscles?
I mean, that's a very important thing. Like as you said before, whatever activities we start doing, we have to be consistent with the activities, and we need to know our body.
Yeah.
And a gradual increasing in the activity is always better. If you are feeling persistent pain in the joints or in the muscles after the activity, if you feel that the joints are getting swollen, particularly knee or ankle, or if you have instability in the joint, if your joint is getting locked, or if you don't feel good balance, these are things which you should look for. If any of these are persistent, then better to step back and go back to your doctor and get it checked. Majority of the time, what we are seeing nowadays is the imbalance in the muscles and stiffness in one group of muscles, increased flexibility in one group of muscles. That imbalance creates the risk of injury. So it is always better to get checked, get trained regularly. Under a trainer is always better if you're doing any specific hit like of training. So yeah, keep observing, you gradually increasing your activity. I think you should be fine. I don't see any problem with that.
Do you think posture correction, there are so many AI tools that have come in for posture correction. Do you think that is important to avoid injuries on long term for
Absolutely. Posture, if you look at into my clinic, if I see young patients between 25 to 50 coming into my clinic, 8 out of 10 have posture issues. Neck problems because the way we are sitting in front of systems, phones, use of phones, shoulders dropping forward, back is getting stooped, the hips are getting stiffer because you're sitting for long hours. As humans, we are like animals. You
Yeah.
should not be sitting at one place.
Correct.
You should be running around.
correct?
But because of our lifestyle now, you end up sitting for long hours. Then you're getting stiffer in the lower group of muscles. All this can affect the posture. The body has a kinetic chain starting from your feet, up the legs, spine, neck, and top to the head. Everything has to be well aligned. If your posture is off balance, then you start using some group of muscles more and the other group of muscles get weaker. That can cause injuries. And injury again exacerbates the problem. Again, your posture, it becomes a vicious cycle. So before you get into that loop, we should check our posture, get it corrected.
So actually, as much as it is important to have preventive cardiac health, it is important to have preventive orthopedic health as well.
Absolutely, absolutely.
So it's so
because
important.
see, movement is life.
Yes,
We know that heart health is very important. At the same time, to keep that heart healthy, you need to have joints which allow you to move.
correct.
Right? If you see the older generation who come with arthritis of the knees or hips or back pain, they can't do too much of activity. And as a cardio, you say, please do activities, but this
They are
will
not able
restrict
to.
them. And certainly, those who are struggling with severe arthritis, there are good options like a joint replacement surgery makes a good deal of change in their life.
Yeah.
They can walk for long distances, even some can jog as well. So yes, very important to be mobile to keep heart healthiness as well as joint healthiness.
Absolutely. I think it's a consortium of everything together.
Absolutely,
Yeah.
it should be a prevention by integration of all the systems
Absolutely.
together, and
Absolutely.
that makes a good life. Thank you very much, Anush, for being with
Thanks,
us,
Srinivas. Thanks so much
and
for
we look
having
forward
me.
for more.
Absolutely. Thank you so much.
Thank you.